all of you know, I hail from New Bern, so I'm from, this is kind of an Eastern celebration, isn't it, Dean? It's nice to be home, and it's nice to be here with people that I have worked so long with, especially my mayor over here with the military and with Seymour Johnson. Al King is terrific. I think the sheriff is here somewhere in the audience, Corey Winters. Thank you, Corey, for coming. And I'm always proud to be with John Carr and Phil Bedore, two of my closest friends and still advisors. And as I look around this room, I'm not going to get the distance to call it names. I see so many people that Billy Ray's already called that are important to me and to North Carolina and important to the future of this state. I'm really always pleased to be with Billy Ray Hall. One of my deepest regrets from the ethics board, we were all so bent on having much more transparency of the ethics guidelines, as stringent as we could get them, was the fact that made my participation on the Rural Centers board kind of questionable. So I had to resign that and my work with the Health and Wellness Commission, and I really miss that. I miss hearing Billy Ray around the table in the middle of the afternoon come up with an idea and then pull all these partners together like we see here and make something fabulous happen for North Carolina. Dean, you're experiencing the benefit of that good thinking from Billy Ray and from others. And let me just call their names again. The Golden Leaf Foundation continues to be a really critical player for the people of North Carolina and Little Jobs. Dan, thank you for what you do. Karen McNeil Miller is here, and I'm calling these names because today wouldn't be happening without the investments and the support and the thinking of these people. Karen with KP Reynolds, I thank you so much for all that you do. Dr. Gerard, Health and Wellness, the new executive director. I interviewed her myself, you all, and I tell my team, my staff, that she's the best interview I ever had. So it has set a new bar for everybody that Chuck Wilson is the chair. Jennifer Sass from the United States Department of Agricultural and Rural Development. I mean, we forget sometimes our federal partners who continue to help us, like the Federal Rural Development folks and also like the Appalachian Regional Commission. That's that group up in the west from where I grew up in Grundy. I don't know how we've gotten their money down here, Dean, but I hope they figure out it goes all the way to the ocean. We are just delighted to have that. And the Office of Rural Health continues to the Office of Rural Health and Community Care continues to be important. Those are the players. Those are the players. 6 years ago, those were the players, and I believe 6 years from now, they'll be the players in making any significant advance in health care in the state of North Carolina. I can remember a day about 4 years ago when, as Lieutenant Governor, I called some of the folks that I just called out, Billy Ray, to the office, to the Lieutenant Governor's office, and I said, Billy Ray, and he said to me, Bev, what can we do to make a difference for health care, to create some jobs, but also, Dean, to do just what you've done here since he successfully left the private sector and became part of this nonprofit, public sector, private sector, serving the people of North Carolina. Y'all, this is a good man. Let's stop just a minute and give him another round of applause. Could he please hurry and build one of these in New Bern, because if I'm going to die in a hospice center, I'd much rather it be at home where my children are in New Bern. Is that okay with y'all? Now, otherwise, I'll come back here. But we had an idea sitting around the room that day. Two of the problems that I've seen over and over in rural North Carolina, the East and the West, is access to care and then getting the health care provider into a rural area. Both of those two things continue to be huge challenges for us. And as we developed this concept that we funded in a first round of funds of $6 million, we focused on creating health care access across the state, doing something that would lure providers either to a rural area or help keep providers stay in a rural area. And one of the derivatives that we really hadn't focused on a whole lot at that time, because that was back in the good old days. You remember when we were all fat and happy and the economy was just roaring along. That was those days. So we didn't have jobs as a main goal, but as a result in evaluating the first round of grants, we've understood pretty clearly that we have helped hire new people and put people to work. In the last 2 years since we developed the idea, North Carolina has infused the rural health system with about $6 million, have done 37 critical projects across the state, projects just like the expansion here at Kitty, I like the name Kitty, and has resulted in 525 new jobs in areas actually that I will argue have been the most hurt, the hardest hit by the recession. Now, 525 jobs and $6 million isn't enough to stop the pace of the national debt. But in rural North Carolina, those kind of small investments actually can save an enterprise from going under. And that's exactly what we can prove with our data. But I actually don't believe, in my mind, and I realized I got to come down here today to make this announcement about our second round of grants. I thought about the Kitty, and I thought about the other investments that we've made in that first $6 million. And I actually don't think, for me as a woman and grandmama and a taxpayer, the big deal is the jobs or the access. The big deal to me is the people. In a few minutes, I'm going to have an opportunity to walk through Kitty and to see people whose lives are better, different, in their final stages of life because they have a new home and their family has a new home to share during their final weeks and months of life. And those kind of hospice opportunities make a huge difference. When my brother in Newbern was dying in the early 80s, hospice was just beginning to take off, and I can remember personally the difference that volunteer coming into the house and helping me and my mama and daddy and my brother's wife and kids. It made a huge difference. And hospice has evolved so much now, and we should all be so grateful and make sure that Dean understands how important his success here at the Kitty is, not just for him and his team, as he so well understands, it's for the people. If you go to the far west and leave the east, which even I am prone to do now and then, I can drive to Sparta in Allegheny County, one of the smallest and poorest counties in the state. And if you ask somebody there what rural hope means to them, they might talk to you about their kid who had a bad toothache and was going to have to drive to Asheville somewhere to get the tooth fixed. Because there was never a dentist in Allegheny County, and nobody ever thought there'd be a dentist in Allegheny County who would want to have a practice in Allegheny County. Rural Hope found a dentist who had a dream, just like Dean had a dream. We stood him up a little practice, and I'm telling you, if you get a toothache or a tooth rot, whatever you want to call it, in Allegheny County, we've got a real professional who's committed to spending his life in Allegheny County. That's how you change health care. You get them to come in and be part of the community and live there and work there and raise their family there. That's how I believe you have to actually measure what Rural Hope has done in North Carolina. And toothache cures, and families who can drop in and hold a hand during a long, bad night, and the health care that we are actually providing. And so today it's a big day, not just for Kitty and Goldsboro and Wayne County, but for people in North Carolina, folks who don't even understand that these first 37 projects are going to be mirrored with many, many other projects, and that every day we're doing our little bit, these partners that I've called, to make life better, to create jobs, but more importantly, to make health care different in rural North Carolina. That's what today's about. I'm proud to announce another infusion of $6 million. The first round of projects will be public by the 1st of January of 2011, I believe. That's a short time to solicit the applications and to review them. But this team that Billy Ray has assembled are very capable of doing that. And I believe this time next year, when you ask me, Biff, what was all that about last September on that pretty day? Did it make a difference? We'll be able to tell you another story about a child who had a dentist in his home county, or about somebody who passed on to heaven in the loving arms of a family member at a place like Kitty, or about the doctor or the nurse or the hospital that stayed in business in rural North Carolina, because there was an opportunity for collaborators to come together and to dream a different dream for rural health care in North Carolina. privilege.